Puzzle this out. Skill rules. Follow the care plan. A presentation brought to you by 4YourCNA.com. Every skill you do for the exam will have certain rules that must be followed. By now, you should be familiar with the opening, the closing, and glove rules. So now we will add in skill rules. The rules for each skill are pretty easy. It's all about the care plan. You have to follow the care plan exactly. So, if this care plan tells us to dress the resident in a long-sleeve button-front shirt, then choosing a short-sleeve pullover shirt is not appropriate. There's a reason the nurse wants the patient in a long-sleeve button-front shirt. The care plan also says to put pants and socks on the patient. Deciding that the patient would be more comfortable in a gown is not your call. CNAs must perform the skill exactly as directed on the care plan. If you do not follow these instructions, you will fail. You don't get to change the care plan, even if you think your idea is better. This care plan may also give you information about the patient's location and condition, as well as information about the patient's abilities. This care plan also tells us that the patient will remain in bed after dressing. Not following directions is the fastest way to fail the exam. So CNAs follow the care plan, the whole care plan, and nothing but the care plan. To pass this skill, you would dress the resident in a long-sleeve button-front shirt, pants, and socks without asking the patient to help, and leave the patient in bed after dressing. We will also observe for any signs of pain, changes in the patient, complaints, or abnormalities, and report those to the nurse. Those are the general rules for all skills. But specific skills will have specific rules as well. For instance, there are 4 documentation skills for the exam. It's extremely important that you document your readings on the form provided, because the healthcare team needs that information to make decisions. And if you don't write it down, the team doesn't have the info they need. Remember, you are nursing assistants. If the nurse has to go back and do it herself, did you really help? If you measure it, write it down. Failure to document can cause you to fail because the lack of reporting can have consequences to the patient. Another skill with specific skill rules is dressing a resident with a weak arm. When helping a person with a weak arm get dressed, you will undress the strong arm first, or USA first. By undressing the strong arm first, you are making the stronger arm do all of the movement. This allows the garment to just slide off the weaker arm with no movement required. Then dress the weak arm first so that the new garment slides on with little movement required. Other skills will require additional rules for the patient's safety and comfort. For all skills that require you to lift an extremity, you must support from below with a flat palm. We're not a claw toy machine. We don't grab an extremity with our fingertips. When you lift from above with your fingertips, they can dig into the patient's skin, causing bruises. And the body part can slip from your grasp and fall, causing injury. So we always lift from below with a flat palm to avoid injuring the patient. Support the extremity at both joints when lifting to minimize stress to the joints. Skills that involve any food or liquid require that the patient is sitting all the way up to do that skill. The patient needs to be in a full upright position, not just a little elevated. This is a safety step to prevent choking, so it is very important. These are a few of the skill rules that you will learn in the program. There are a lot of principles to cover, but don't worry, we will get to them all. Before every skill, we will learn or review the principles relevant to that skill. That way, they are fresh in your mind when you're learning the skill. You will also see many of these rules in our book, CNA Skills Made Easy. If you haven't ordered your book yet, now would be a great time. The book makes learning the skills so much easier. Next up, our first skill. The next lesson will provide an introduction to learn the important principles. And then we will dive right into the actual skill. Use the step-by-step instructions in the book to practice it yourself, and you'll be a pro in no time.